Good afternoon, and thank you for joining us. Today is Tuesday, November 30th, and on today's briefing, we'll hear from Mayor Tom Barrett, Milwaukee County Executive David Crowley, Dr. Ben Weston, Associate Professor at the Medical College of Wisconsin and Chief Health Policy Advisor with Milwaukee County, and Commissioner Kirsten Johnson, Commissioner of Health with the Milwaukee Health Department. Thank you all for being here, and Mayor Barrett, I'll hand things over to you to get us started.
Well, thank you very much, Catherine, and it's good to see you all today. I think we all recognize right now that Omicron variant is the key issue that we're dealing with. And as President Biden said, this is not a cause for alarm, but I think we do have to be concerned with it. And there's much to be learned about this new variant, but it does give us reason to be concerned. It continues to be important to follow recommendations from not only our local health experts, but I think the state health experts, as well as the national health experts, as we try to navigate this new variation. With Omicron being a variant of concern, our health department commissioner has issued a new mask advisory as a formal declaration that we are taking this very, very seriously. And you'll hear more from our commissioner about that later in the briefing today. Vaccines and standard mitigation measures, such as masking, practicing good hygiene, and staying 6 feet apart, also continue to be our best tools in fighting this virus. So our song continues to be the same. Let's get the vaccinations. Let's do what we can to take those standard mitigation measures. We can see that this is something that developed overseas. We're obviously concerned because it's in Canada. What will happen if it comes here, how serious it is. And let's be real, we're all tired of this. Everybody's tired of this. We want life to go back totally to pre-COVID, where we can ignore all of this. But we have to continue to be mindful that our hospitalizations are up, our deaths are obviously going the wrong direction. We're seeing increases in transmission of this disease. So it still is something to be very, very concerned about. We remain in the extreme transmission category for COVID-19 cases per 100,000. As you can see on the screen here, we're at 214.9 cases per 100,000. That number, unfortunately, is up from the prior week. You can also see that our percent positivity rate is now in the substantial category as well. That's not where we want to be, but the transmission is now at 8.9%. This is also up from last week. Our vaccination rates, we're getting even closer to 60%. We're at 59.8% of City of Milwaukee adults. That's individuals 16 or older who are fully vaccinated, and 64.7% of adults have received at least one dose. But as I look around major cities around the country, I see a significant number of cities that have a higher vaccination rate than we do here in Milwaukee. And our health department has done a phenomenal job in outreach and trying to connect people with the vaccines. But we understand, and I understand, it's an individual choice and people have to do it. But I continue to read the stories and see the stories on television about people who did not get the vaccine and have found themselves in a very, very bad place medically because of it. And so this is all about health. It's about your health. It's about your family's health. It's about the health of the community. So the CDC recently announced that all adults should get a booster shot of vaccine 6 months out from their last dose of Pfizer and Moderna, and 2 months out from their last dose of Johnson & Johnson. So if you have not received your booster, please make it a priority to do so as soon as possible. This is very easy to do. This is not difficult to get these booster shots, so don't feel in any way intimidated. The pandemic continues on, and vaccines remain our best way to move past this virus. Testing also remains important in detecting the spread of the virus in our community, and following holiday gatherings, please seek testing if you are feeling symptomatic. Again, holiday gatherings, a lot of families got together. My family got together. It was great to see my nieces and nephews and grandnieces and siblings, as well as our own children. But we all know that having a lot of people around can lead to transmission as well. Talking a little bit about upcoming vaccine clinics. For those looking for first, second, or booster doses or flu shots, there are opportunities throughout the week across the city. We are back at our school-based clinics for a second round of vaccinations. We've had great partnerships with the Milwaukee Public Schools, with the Seton Schools, with some private schools, so that the kids who want to get the shots and whose parents want them to get the shots, they can get them. So we're very, very pleased with that partnership. I want to take a moment to thank everybody who has stepped up to make this possible. Again, our school and health partners have been really, really, really great, but also the parents and staff who have championed this work to keep our children safe. I think we recognize that there was an outbreak in one of the MPS schools just in the last 48 hours. So it tells you that we clearly have a lot more work to be doing. In addition to our school-based locations, the UWM School Union, the UWM Union, Ascension All States Family Health Center, and Myanmar Learning Center are offering vaccines to the public as well. One more thing I wanted to share, and that's about the Bucks. The Bucks are winning a lot of games now, and I'm happy about that. Finally, they're winning. They've got a winning streak going, and that's overdue. But what's not overdue is having people go to Pfizer Forum to get their shots. This is a great opportunity to get the Pfizer Forum, to get a chance to pose with the Larry O'Brien Championship Trophy, and possibly even to win tickets for the Bucks game Saturday night against, I think it's Saturday night, but the game against the Heat. So stop by for first, second, and booster shops of Pfizer, Moderna, and Johnson & Johnson. We'll be back at the Pfizer this Saturday, December 4th, from 10 a.m. to 2 p.m. In partnership with the Milwaukee Bucks. We love that partnership. So again, get there. You can obviously enter for the drawing for the tickets for that night's game against the Miami Heat. So with that, I'll turn it over to our partner, County Executive David Crowley.
Good afternoon, everybody, and thank you so much, Mayor Barrett. As you can probably tell by my background, December marks Universal Human Rights Month, and this is really a time for people around the country and around the world to really join together and stand up for the equality, the rights and dignity of all individuals. And this is a critical time for everyone, honestly, to come together to help protect ourselves and our community, and especially those that we love. And especially now as we kick off Universal Human Rights Month, and as we see COVID-19 cases rising locally, we need to come together really to protect our community and our neighbors. And this might mean having those tough yet needed and respectful conversations with your loved ones or your friends about why getting the COVID-19 vaccine is so important. Everyone is entitled to their own opinions, but sometimes those simple nudges and respectful conversations is what's needed to change some people's minds to really get this vaccine. And as Mayor Barrett mentioned, the World Health Organization has labeled Omicron or Omicron, tomato, as a COVID-19 variant. And that poses a very high risk. And so the best advice that we can give as of now is to listen to your local public health experts, as they are our trusted local source of information. And so research is still ongoing to uncover more information on the new variant, but we do know that the best way to protect yourselves and keep everyone safe around us is to get vaccinated or to get your booster shot. And the CDC yesterday announced that all adults should get their booster shots. And in fact, I'm actually getting my booster shot tomorrow. I have little ones at home who are not able to actually get the vaccine. So I'm going to make sure I'm taking all the necessary precautions to keep them safe and those that are around me. And so this is a time to get vaccinated or to get boosted as we enter into the colder months and the holiday season, and now with this new Omicron variant. So I want to ask everyone to be cautious and continue practicing good hygiene practices and get tested if you are feeling symptomatic. And then just yesterday, Supervisor Wasserman introduced a resolution declaring health information as a public health crisis and really affirming Milwaukee County's commitment to health equity. Misinformation is a threat to public health as it causes confusion, and really it undermines public health efforts and prevents people from seeking preventative care and diagnostic testing. And so we cannot let misinformation lead to additional rumors, especially during times when cases are rising and Omicron is likely starting to spread throughout this community. So we need to remain calm, trust our local public health experts, and get vaccinated or boosted as soon as possible. So again, thank you for joining us this afternoon. And with that, I'll hand it over to Dr. West.
Thank you, Mr. County Executive. Good afternoon. First, to our numbers, we are currently seeing in Milwaukee County an average of 231 new cases per day and about 2 deaths per day. Wisconsin currently has the 4th worst rate of COVID positivity of any state in the country. Locally, we're seeing increased cases, increased positivity, as well as hospitalizations. Now, we'll of course talk today about Omicron, but even if Omicron does not end up being as bad as predicted, we still have Delta to deal with. We are in the middle of a Delta wave with record cases and record hospitalizations in Wisconsin for all of 2021. In fact, the entire western region of our state has 0 ICU beds available. 0. This is a dangerous place for our state as well as our country. We're entering a long winter, a holiday season with poor trends and a new variant on the horizon. But let's first talk about that variant. So what is Omicron and what does it mean for the future? We can start with what we know. One thing that we know is there's 2 ways to pronounce it. So Omicron and Omicron. All right, that's the easy part. But we also know that this new variant has many mutations that make it different from previous variants that we've seen. In fact, it has far more mutations than we've ever seen in a circulating variant. Now, what the effect of these mutations will be is still uncertain. While the exact level of transmissibility or the ability to spread is not definitively known, we have seen that in South Africa, for example, where this variant was first sequenced, it's rapidly become the dominant variant. It's outcompeted the contagious Delta variant. Furthermore, we've seen this variant now identified in 20 different countries. That was updated about an hour ago. 20 different countries now across 5 different continents, suggesting that it has a substantial ability to spread. And what we do not yet know is the severity of the variant. Is it more or less likely than Delta to put you in the hospital? And we also don't yet know the ability of the variant to evade the immune response, particularly how effective our vaccines will be against it. Now, we'll certainly know more on these fronts in the coming days to weeks. What we can be quite confident in is that this variant will soon be here. It is likely that the next day or 2 we'll sequence this variant somewhere in the United States, and it will rapidly spread to our community as well. In our very first briefing on coronavirus back in March of 2020, standing in person in the apparatus bay at the Milwaukee Fire Department, I said that this was a time not for panic, but for preparation. And that could not be more true than today. Our vaccines have been effective against every variant we've seen so far, and it will likely have a pretty good level of protection against this one as well. So getting vaccinated and getting boosted is the best way to prepare and to protect yourselves and your families. The booster guidance is now simple. All adults 6 months out from Pfizer and Moderna or 2 months out from Johnson & Johnson should get boosted. And for those who've been on the fence about the vaccine, now is the time. A storm is brewing, and the best way to prepare by far is to get yourself vaccinated. And getting vaccinated is easy. You can go to your local drugstore, to your health department, or call your doctor. It's free, it's safe, it's effective, and it's as urgent now as ever. So don't delay another week and end up regretting it. Get vaccinated now. Thank you and stay safe, and I'll hand it to Commissioner Johnson.
Thank you, Dr. Weston. The Omicron variant has been confirmed in 20 countries across the world after first being identified by leading epidemiologists in South Africa. The Milwaukee Health Department lab sequences 100% of the PCR specimens that we process on site, as well as a percentage of positive PCRs from other labs, which we prioritize based on location, whether it's the city of Milwaukee, Milwaukee County, or elsewhere. At this time, as of today, no PCR specimens processed by the Milwaukee Health Department lab have been identified as Omicron. Anticipation of future identification of this variant in Milwaukee, and due to the burden of positive COVID-19 cases remaining in the extreme transmission category, the Milwaukee Health Department is issuing a mask advisory for all individuals, regardless of vaccination status or past COVID-19 infection. And this advisory is to wear a mask at all times when indoors in a public setting. COVID-19 is predominantly transmitted by inhaling respiratory droplets, and studies have shown us that masks effectively block the release of these droplets into the environment and protect the wearer from exposure to other droplets. Because we are continuing to learn and more in the coming days and next week about the Omicron variant and its degree of transmissibility, it is crucial for us to layer measures to protect ourselves and our community. Another, and arguably the most important measure, is vaccination. Vaccination remains our strongest tool in the fight against COVID-19. And currently, only 59.8% of Milwaukee adults 16 years and older are fully vaccinated. COVID-19 vaccines and boosters are readily available at all of Milwaukee Health Department sites with no appointment. Everyone 18 years of age and older is eligible for a booster if it has been 6 months since your second dose of Pfizer or Moderna, or 2 months since your single dose of Johnson & Johnson. In addition to our standing sites at the Northwest Health Center, Southside Health Center, and Menominee Valley, a full schedule of COVID-19 community vaccination sites can be found at milwaukee.gov/COVIDvax or healthymke.com. The vaccination clinic at Pfizer Forum this Saturday is an excellent opportunity to get vaccinated, get your kids vaccinated, get a booster dose, or even get a flu shot. Knowing the incredible turnout we had for our first clinic on November 13th, we plan to have more vaccinators on staff this Saturday. Come get vaccinated, take a photo with the Larry O'Brien Championship Trophy, and be entered to win a 4-pack of tickets to that night's Bucks game against the Miami Heat. We have 2 packs of tickets to give away, and be sure to wear your mask. Thank you.
Thank you, Commissioner Johnson. Our first and only question at this time is from Terry Sater with WISN 12. He's wondering for the health experts on the line, the numbers show the number of children getting COVID over the last 90 days has spiked. Can you elaborate on how that's impacting schools and vaccination rates?
So right now, the highest positivity rates we're seeing across the county by age range are in our 10 to 14-year-olds, and that's closely followed by our 5 to 9-year-olds. So without a doubt, this impacts school. We've seen outbreaks and quarantines and isolations in schools throughout the county, but it also impacts the community. And of course, it impacts these kids, both with short-term as well as potential long-term effects. So I think in the end, we need to see more kids vaccinated. Any child 5 and older is eligible for the vaccine and should get vaccinated. There's many, many different options out there, and you can go to healthymke.com to see which sites are doing childhood vaccinations.
Thank you, Dr. Weston. Drake Bentley with the Milwaukee Journal-Sentinel is wondering, for the mayor and county executive, are discussions being held for reinstating a mask mandate?
Thank you for that question, Drake. So we've always had our mask mandate kind of being instituted within Milwaukee County buildings. So we still require masks on county properties inside. So that is still our policy here.
And the city of Milwaukee, again, for our employees, we continue the policy we have had. But we have had conversations with the health commissioner and others about a mask mandate. Again, obviously the announcement today from Commissioner Johnson is that this will be a mask advisory. We continue to monitor these numbers. We know that there is serious concern with the Omicron variant. And so we're continuing to monitor that. I don't know if the commissioner wants to add anything, but it's something that is always in our conversations.
I can add, there's another question in the chat specifically around the mask advisory versus a mask order or mandate. The mask advisory is really, again, there are more questions and answers right now around Omicron. What does that mean? We don't know yet the transmissibility. We don't know yet if it evades immune response with the vaccine. So we're really just advising people, strongly recommending, but an advisory that people mask when indoors and in public. Again, really it's trying to be cautious, thinking, again, we don't know exactly how this is going to play out, but we want to make sure that we are adding a level of a layer of mitigation to assure that people are safe.
And Commissioner, just a follow-up question. Christina Van Zels with Fox 6 is just wondering, what would it take for a mask mandate to be put in place? And is that something being considered?
This is a really good question. It's certainly something we talk about frequently. Our cases in the city of Milwaukee specifically have leveled. I mean, we're at a high transmission, but it's been sort of flat. It's not spiking. I think what we need to see is a significant spike, but I also think, there are other things to take into consideration. A mask mandate in the city of Milwaukee would only apply to the city of Milwaukee. It doesn't apply to the county. I think that's a barrier to having an effective policy in place. And there are other things that we're taking into consideration as well. So I can't say, it's not really black and white. Again, at this point, we're thinking very much about Omicron and what does that mean and what does that look like? And as we learn more, we'll have more conversations.
Thank you, Commissioner. Our next and final question that I'm seeing in the chat is from Victor Jacobo with CBS 58. He's wondering for Dr. Weston, you mentioned how Western Wisconsin has 0 ICU beds. How is Southeastern Wisconsin doing in terms of ICU bed availability?
Yeah, thanks for the question. So we are lucky in our region to have several large hospitals with a good amount of capacity typically. Now, nonetheless, they're quickly filling up. So in Southeastern Wisconsin, 92% of ICU beds are occupied right now. And this is an example of how COVID affects not only those sick with COVID illness, but in many regions, it affects others who need medical care. And this is made much more challenging due to the COVID burden on healthcare systems really across the country.
And Dr. Weston, Terry Sater with WISN 12 is wondering, what is the vaccination rate for children in Milwaukee County? And are you seeing interest in clinics at schools?
We are just starting to see data coming in on the younger age groups with vaccines. So we'll continue to watch that data. When we look more broadly nationally, we're seeing between 10 to 15% of kids in that youngest age group that have gotten vaccinated. As far as clinics in schools, there certainly have been different municipalities are doing it in different ways.
And Eric Gunn with the Wisconsin Examiner is wondering, is there any information yet about Omicron and its relative impact on younger people and children?
Short answer is no. We continue to closely watch data from South Africa, where they've been able to sequence a large number of cases, and from other countries that are seeing Omicron right now. But that information will come, I think, in the next week or two.
And a quick follow-up question here. Are there discussions about measures to further reduce spread in school settings?
Well, obviously, we've seen some actions taken by the Milwaukee Public Schools recently when they reached that threshold for number of kids who have tested positive. So I think that you're going to see not just in the Milwaukee Public Schools, but at schools throughout the region, as the numbers climb for kids, more and more conversations about what the next appropriate course of action is.
And I would just echo what Mayor Barrett said, but the Milwaukee Public Schools are requiring masks and have since the beginning of the year. And we know masks are effective specifically in a school setting because it's in a controlled environment, but it is effective at stopping the spread within classrooms.
And I've got another question in the chat or piece of information. I'm not sure if anyone else has additional context, but Terry Sater is saying that the medical examiner says there's an outbreak at 1414 North Prospect, the Ovation Nursing Home, including several deaths. Not sure if anyone has additional context that can be provided at this time.
I think we'd have to look into that and get back.
Thank you, Dr. Weston. All right. At this time, those are all of the questions that I have in the chat. Thank you all for joining. Thank you for the great questions, and we'll see you next week.
Thank you all.
Thanks, everyone.